Thank you so much, Steph. With COVID-19 cases on the rise, many of them coming from Toronto, as we know, Premier Ford says new restrictions are on the way and talks about a potential lockdown, what that could potentially look like for Toronto and those other hotspot regions. Mayor John Tory joins us now with the very latest with what we're watching here in the city. Good morning to you, Mayor.
Good morning, Mel.
So we are expecting to hear a bit more tomorrow. What do you anticipate, or what are you and the public health team recommending to happen?
Well, we've been very careful so as to avoid, public confusion any more than there already is out there, not to sort of make public our list that we've sort of sent to them. It was sent by our medical officer of health to their medical officer of health, and that's the way it works. And then it goes to the cabinet. So that's what's taking the time now, is consideration by those people. And I will just say that, we already have the most restrictions in any of the hotspots, because the city put some on top of this red zone regime of the provinces, because we just felt the situation was serious enough here to warrant further measures. And so we've recommended still some further measures. And, I've given the example before of one of the things that obviously we've taken a look at is how to manage capacity better in retail, so that you don't have kind of crowd scenes or people in too close a contact with one another. And so that's the sort of thing that everybody's taking a look at. And that's an example I don't hesitate to mention, because we've mentioned it before. But otherwise, we'll see what the province comes up with tomorrow. And in the event that they make different choices than what we recommended, we will take a look at what the city itself can do. But it's always preferable to have a provincial order, because then you can have a deal with the region as a whole and have one set of rules, and it's easier for us to explain to people what they're supposed to do. But the best advice still, please stay home.
Mm-hmm. And there are a lot of businesses that are watching right now saying, please, 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 I do not want to see a closure of this, that, and the other thing. But are we looking at, you think, more restrictions versus closures? Because there's a clear distinction.
Well, again, the province will decide that, but I can just tell you we've spent a lot of our time trying to make sure that businesses can still do business, because that's a lot of jobs and businesses that depend on that. People want to be buying things for Christmas and so on. But at the same time, we're trying to reduce crowd scenes. So we're very focused on how to try and achieve the maximum public health benefit without doing undue damage to business. And that we spend all of our time. People who think somehow we just, in a cavalier kind of blithe sort of way, say, oh, let's just close things down. It couldn't be further from the truth at the province or at the city. We're very concerned about that, but we're also trying to make sure we wrestle this virus to the ground.
And we've got holiday shopping season underway right now. Toronto, home to some of the biggest malls out there. You have alluded to this before in the past about looking at potentially capacity within mall settings. Is that something that you foresee moving ahead?
Well, the malls have done a great job, interestingly enough, of putting directional signs on the floor and having people at the door to greet you and so on. And but I was sent a lot of photographs by people saying, so, John, what are you going to do about this? This past weekend, where there was just huge crowd scenes in those malls, and it's not so much in the stores as it is in the kind of the mall area itself. And I think when you close things down, other things, whether it be restaurants or whatever, you end up with people deciding they're going to go to the mall. So all of those things are things that are worthy of looking at, with the objective being not to close people or to stop people from having places to go, although we do strongly recommend people just stay home with the people they live with, but making sure that if they're going to go to a place like that, even for a necessity, that it's done in a safe manner.
When you heard about that party at that storage unit, the one where 100 people were gathering, what goes through your head when you see things like that? And should we be seeing stricter fines or more enforcement? I know your team has been doing a lot, but can more be done?
Well, aside from exasperation, I sort of wondered who would want to have a birthday party in a storage, unit. But having said that, you get frustrated, because we put the message across very clearly. Please don't go out at all. Please don't go visit friends, even at their homes. But least of all, please don't. And in fact, it's against the law to have gatherings of 100 people. And so the organizer of that got a ticket. I've had a lot of emails from people saying, why didn't you give a ticket to every single person there? Because we have a law that would provide for them to get, I think, a ticket for $750. And they try not to do that. But I don't direct law enforcement, but I'm to the stage now where I think, well, if people themselves who were asked to attend the party know what the rules are, maybe they should get a ticket, just because if they're deliberately, going. So it's frustrating. And again, we ask people to please stay home. They just follow that rule and don't qualify it by saying, well, I'm just going to go to a storage unit party or just over to see two of my friends at their house. And we're putting a special message out to parents. The fastest growing group of infection in the last couple of weeks in the population has been young people aged 13 to 17 and age 17 to 23. And we think that a lot of that is kind of hanging out after school, as it were. I had teenage kids at one time, and I know you don't control that part of it. The schools themselves are quite organized on what goes on in the classroom. So we're asking parents to really tell your kids, you've got to come straight home from school and not hang out with your friends, as hard as that may be, for the next little while, so that we can stop the spread to the kids, because the kids then give it to the parents or the grandparents, and on it goes from there.
And then it spreads into places like long-term care homes, where we are seeing a surge in numbers, and it's horrible to see. I want to get your take on the current situation in long-term care homes in the city, and what else could potentially be done. I know a lot is being done, but what else can be done?
Well, it's a continuing tragedy. It's a bit diminished from what it was in the spring, but it's still a tragedy. I mean, any loss of life, these are frail people to begin with, and so they're more vulnerable. We've said that all along. So in the case of the ones the city owns, and we've had a problem with one of them, we have now, for example, got all of our staff people working in only one of our residences so that they don't move back and forth, and that's something that is yet to be achieved, I think, in the rest of the sector. The R10 is only a minority of the places in Toronto. I think the government has now indicated, and we were certainly talking to them about this, more frequent testing for staff, because that's how this gets into the long-term care principally, is by staff people coming and going. And God bless the staff people, they do a fantastic job, but they come in and out, which of course the residents do not. So we're all working really hard on that, because I think there's nothing the public would want us to make more of an effort on than to protect these frail elderly people who, after all, are somebody's grandparents or parents or, you know, whatever. We know that.
Finally, for you, let's get to some positive news. The news of vaccines. So we've heard about a rollout from the province. What does that distribution or rollout, obviously the plans are underway right now, what does that look like for the City of Toronto?
Well, it's interesting because we're kind of the retail, so that the actual, we don't distribute the vaccine. You know, they're having some discussions with the other governments about that. We are the retailers. So in other words, we're the people that have to organize the places you will go to get the vaccination. And of course, we have to arrange places where we can store the vaccine, because you've heard both of them have to be stored in cold. There has to be places where it can be able to handle big crowds without them all being, you know, in a crowd scene that would be spreading the COVID virus. So we're looking at very large places where we could do this. People might remember, some people might, the flu vaccine we did about 10 or 15 years ago, and it was done in civic centers and places where you had big spaces, people could spread the lineup out, and you could handle thousands of people. So our job, the cities, is to organize that kind of retail distribution of the vaccine, the actual vaccination done by public health, and we're trying to find the places, and we've got a good plan that's being put together, and find the places to do it and make sure the storage can be there to keep the vaccine safe and all that kind of thing, and we'll be ready.